Good afternoon and welcome everyone to today's webinar, Palliative Care Chaplains and Cambia Sojourn Scholars. I'm Andrew Andresco, Project Coordinator for Transforming Chaplaincy, and we are all delighted you could join us. Some housekeeping and instructions off the top. This webinar is being recorded. You are listening in using your computer speaker system by default and are muted. Should you have any technical questions regarding your audio visual, please type those into the chat box located in the platform's dashboard. You will have the opportunity to submit questions for our presenters by typing your questions into the questions box of that same control panel. You may send in your questions at any time during the presentation. We will collect these and we hope to include them in a hopeful Q&A session at the end of today's presentation. With that, I'd like to introduce Chaba Salaji, Director of Transforming Chaplaincy. Chaba?
Thank you, Andy. Welcome everyone, and especially welcome our Cambia Sojourn Scholars and leaders in palliative care. As we get started with this webinar, just a few things I want to plug in here. The first is our Research Literacy 101 course is starting in September, and you see the QR code on the screen. Please go ahead and register if you're interested in taking this course. On theme with palliative care, we have the team conference coming up in September. So please register. This is a great conference that brings the interdisciplinary hospice and palliative care team together to explore best practices. And this is the first year when we, as Transforming Chaplaincy, has partnered with the Hospice and Palliative Care Nurses Association and the Social Work Hospice and Palliative Care Network to put on this conference. And I also want to remind you of the upcoming interprofessional spiritual care education curriculum taking place online this fall, run by our friends at GWISH. So if you're interested, please, again, follow the QR link and explore this great program. And with all this, I will turn it over to Paul Golshat, and he will introduce our participants today.
Everybody, thanks for joining us. We are glad to have you be a part of today's webinar hosted by Transforming Chaplaincy through the Hospice and Hospice Palliative Spiritual Care Research Network. Got a little jumbled up there myself as well. I get to serve as the convener. We'd love to have you join us. You'll notice baseball is a theme. You'll hear that over the next minute or two. It's a great place for you to learn about the latest reads, webinars like this, and a place to kind of explore and coordinate. Next slide, Andy, if you will. And we'd love to have you join. Want to make it easy for you. One thing, and why I keep showing this slide in case you've joined any of our previous webinars, is I'm always just a little anticipatorily wanting to know, was this player tagged out at home? So in case you know baseball, we're kind of waiting to see whether that catcher has that ball in the glove. Whether or not that happens or not, I'm just glad you're a part of our home, so to speak. And today's moderator, I just want to say for all three of the people who are here, we will be joined in a moment by Pastor Corey Kennard. Allison Kestenbaum will be moderating this. It's fun for me to say for all the intros, for you, Sarah, Allison, and Edward, that I don't have to like have a separate bullet point that you're these Cambia Sojourn Scholars. I kind of get to kind of say it all at once. For all of them, each of them, I could say a whole lot, and we just have a few bullets to offer some introductions. They're going to talk a little bit more about themselves and their projects related to the funding they've received from the Cambia Health Foundation. Allison gets to serve as the Manager of Spiritual Care Services and Clinical Pastoral Education at UC San Diego Health. She's a spiritual and palliative care researcher, and she's one of the founding faculty members of spiritualaim.org. Please bookmark that for yourself. Next slide, please. Oh, will you go back? Andy, I forgot. This is part of the baseball thing. I do ask people, were they ever to walk to home plate carrying the bat? What would their walk-up song be? And I love this, A Tribe Called Quest. Check the rhyme. It's kind of going through my head. Thank you, Allison. Next, Edward Peñate. I think I saw. Nope, it's Sarah. Sarah Byrne-Martelli. You're definitely not Edward. Sarah gets to serve as a palliative care chaplain at Massachusetts General Hospital Division of Palliative Care and Geriatric Medicine. She's been doing this work of palliative or hospice chaplaincy since 2002, and she gets to serve on the faculty of the Harvard Medical School Center for Palliative Care. Sarah, your walk-up song is? none other than the Queen of Souls, Rock Steady. And you had mentioned before, there's maybe a recording of this somewhere? No? Okay. All right, so finally I'm getting the names right here. Edward, you are next. Friends, we are also glad to have Edward Peñate with us. Edward gets to serve as the palliative care chaplain with the section of palliative medicine and spiritual care department at Northwestern Medicine in Chicago. With his research, he's currently testing a screening protocol for religious spiritual struggles by palliative care non-chaplain healthcare staff. Looking forward to those results someday. And Edward, your walk-up song is, next click, please. Black Sheep. The choice is yours. Was it tough to choose between this or that? You knew I was going to say that. All right. And Pastor Corey Kennard is not a Sojourn Scholar, but he serves as the National Advisory Board member to it. He's also the pastor of Amplify Christian Church, and he's a healthcare leader. You'll hear more about that when he comes on here. Next slide, please. But here they are all together as our panel. And Allison, I'm going to invite, oh, his walk-up song. Yeah, he's not here, but he did choose Pink. Never Gonna Not Dance Again. So kind of a cool pick. All right, thank you, Andy. Next slide, please. And here's the panel. Allison, take it away. Thank you, friends, for being here.
Well, thank you to Transforming Chaplaincy. Thank you to the Cambia Health Foundation and the Sojourns Scholar Program. Thank you to Paul and Shaba and to our panelists. I am so delighted to be in the company of these folks today. There's Corey, welcome. Great, you are introduced. So what we're gonna be doing is I'm gonna share a little bit with you about some of my experience as a Sojourn Scholar and about the fellowship in general and how it has really helped to shape the field of palliative care and some of the wonderful potential that has come for spiritual care and for chaplaincy. And you're seeing that, you know, in these panelists. And then I'll hand it over to Edward and Sarah to talk about their projects that are currently in process. You know, the vision that they have for this work, and then Corey in his role as an advisory board member and one of the folks that's helping to really set policy and the future for palliative care leadership and being involved in that advisory board and being our mentor in this process as a palliative spiritual care leader. So I think we can go to the next slide. If I can do that. Okay, great. All right, well, I'll tell you who that adorable person is on the bottom right in just a moment. And so if you don't want to listen to me, you can just look at her picture. But I just wanted to tell you a little bit about the Sojourn Scholar Leadership Program. As I mentioned, it's the Cambia Health Foundation, which is the entity that has so generously sponsored this for almost 10 years now. So since 2013, the foundation has invested in $17.2 million, supporting, at this point, it's 96 professionals. Probably by the time it has its last year, I think it will be, you know, another 10 or 12. That's an incredible investment and contribution in the field of palliative care. And these are $180,000 award grants that gives those that are so fortunate to be awarded it the opportunity to have half of their professional time dedicated to work on some kind of project that's going to advance palliative care. And you know, the folks that you're seeing on the screen today, we are all focused explicitly on spiritual care. But you know, I should say there are other Sojourn Scholars whose projects either directly or indirectly have a focus on spiritual care, meaning making, holistic care for people, you know, as whole people. So that's been a really wonderful thing to see as I've gotten to know some of the other Sojourn Scholars who are physicians, nurses, social workers, pharmacists, various disciplines represented. And so I received the Sojourns Leadership Award back in 2018. And I'll just tell you a little bit about the project and what this enabled me to do. And just sort of biggest picture, I will say that We did not have a CPE. So if you know what CPE is, clinical pastoral education, it's the gold standard for training chaplains of any discipline, whether they specialize in palliative care or not. We did not have that program at UCSD, and there was interest in it. And I have the credential as an ACPE educator, but it really was the Sojourns program that gave the opportunity for us to start it, you know. And it was not just about the funding, because in reality, we didn't really use the funding actually for the operational expenses for the CPE program. The institution was able to cover a lot of that, but it was really the investment from an entity like the Cambia Health Foundation to say that not only do we think CPE is important enough, but we also think palliative care specialty CPE, where students who are mostly spiritual leaders or clergy, but others as well, that they would have immersive experiences with palliative care teams, inpatient, outpatient, to really see what that looks like, and that whether they go into palliative care, hospice or not, that's going to make them better spiritual leaders, you know, which is not surprising to me and anyone who knows palliative care, because palliative care is, you know, a holistic approach, right? And that we are so invested in that interprofessional approach to benefit patients and their professional and family caregivers. So it was so awesome to have that endorsement. And what it allowed us to do was to provide extra help for people who wouldn't have been able to do CPE. We were really interested in some of the literature out there, and anecdotally, I think we all know this, where there's a lot of folks working as clergy who are advising people who are seriously ill, and they maybe have never spent significant time in an ICU or in a palliative care unit. And that's no fault of, I mean, that's great. I actually wish that for most people, that they should never spend time in those settings. But just what does that mean if you are the clergy that's advising people on these very big decisions, but you haven't ever had the time to talk to a palliative care nurse practitioner, for example, or physician, right? So we really wanted to have these folks encountering each other, and sort of also, I always say, like, the secret, it's not such a secret, but it was also said that these medical providers could also really have true encounters and build relationships with these spiritual leaders, so they could understand a little bit more about that perspective. So that's what we did. And we have, you know, the other thing that the Sojourns opportunity, I'll just say a quick thing about the rarity of having protected time. You know, for chaplains to have protected time, it's almost unheard of. I know Transforming Chaplaincy is invested in that as well. But just what we've been able to, you know, produce from this, right? You know, so 65 interns trained. We have several publications that, you know, just being able to have some time set aside to be able to do that and focus on that. It was really just such a huge vote of confidence. You know, it was about the time, but it was also about, you know, that vote of confidence as a chaplain to say, you know, you can implement something, and then you can tell the world about it. You know, there's information to disseminate to try and, you know, hopefully inspire others, and also for others to kind of point out some of the gaps in what you did, and then take it and make it theirs and fill in those gaps. So, you know, so those are a couple of things that came of it. Collaborations now with, you know, various palliative care projects happening in, like, end-stage kidney disease, ALS, you know, just this idea that we could actually use some of the research and some of the methods that we developed in this project to implement, you know, in various aspects of palliative care. So that's just super exciting to be able to see that implemented. I think more and more now we have a clearer pathway for chaplain career advancement, you know, just by having folks like Sarah and Edward, and hopefully myself, you know, not that everyone has to do it our way, but honestly, when I got into palliative care chaplaincy, there was not a clear pathway. So, you know, to begin to develop that so that folks can sort of know how they can, you know, get the credentials that we need, not just as hoops to jump through, but to provide the best spiritual care possible. I'll also just mention that this opened the door to collaboration with entities like CAPC and AHPM to really say chaplains are an important part of the spiritual of the palliative care team, and we want them as part of our faculty. They have something to teach not only chaplains but every member of the interprofessional team. So that's been really, really exciting. And one other I should have put the QR code, but we do have a hospice and palliative care listserv now, which we've never had before, that Transforming Chaplaincy is giving us technical support for. And we'd love to have you all join us, of course, for that. So really, I think, you know, the upshot, I'll just sort of wrap up in a minute here, but, you know, just all of these opportunities that this investment has provided, and it's only going to be just more and more as Sarah and Edward, you know, tell you about their project and what the ripple effects going forward. And I'll just say briefly about the personal kind of return on investment. So being able to work on leadership development while also working on other aspects of my life. So this is my daughter, Gilda. This is a picture that I took of her right after I got off the phone, learning that I had received the award. It just happened to be that she was like, you know how babies are, they reflect, you know, the expressions of their caregivers. And I really appreciate this picture because I must have been super happy and excited and to just see that reflected in her face. But it also just, quite frankly, I was able to receive this award. I was working on the application like while I was pregnant, and like when she was a newborn. It was, her birthday was May 5th. The application was due like May 31st. And, you know, I just feel so blessed that this came to pass. But it really gave me an opportunity. And I know, you know, not everyone has this opportunity. And I wish there were more of this, you know, for me to be able to develop a CPE program in palliative care with amazing partners at UCSD, but also, you know, be present, you know, in other aspects of my life. And so I will always be, and that was just the timing of it, but, you know, all chaplains have things going on in other aspects of their life. And if we could have opportunities that help us sort of pursue those various, those aspects that give us meaning, I just think it's so important. And then just one more thing I'll say is about, you know, just over the last 3 years, I've had the opportunity to talk with pretty much every chaplain who's applied for this. And I'm so hopeful and excited about what's coming. You know, I mean, obviously not everyone has been able to get the award. And I'm just so excited, and, you know, for Sarah and Edward, and so well deserved. But just, you know, I just feel like there's so much, I feel so much optimism about what's coming. You know, when I started in palliative care chaplaincy, I felt like maybe I knew everyone who was involved, and now I don't. And that's actually a really great thing, you know, that it's not just the same 10 people doing it. So it's just great to, you know, have all of these people here on the webinar who are interested in this, and just really excited to continue to see that return on investment in so many different ways. Great. Okay, so next slide, and I'm going to hand it over to, is it Sarah's next, right? Okay, great.
Yes. You hear me okay? Great.
Yes.
Good to see y'all. Well, so this is the busy slide, but I'm going to talk for a minute before I get into it. And I'll say when we had our Cambia Sojourns Scholar Summit Leadership Summit, where we get to meet with all the different Sojourns leaders over the years, which was just amazing. And you had to put together an elevator speech. And the beginning of my elevator speech went something like this. 4 Catholic priests, 4 Orthodox rabbis, and 1 board certified interfaith chaplain walk into a bar, except it's not a bar, it's actually NYU Medical Center in 2006. And that was my setting for my work. And so in other words, I was the only board certified multi-faith chaplain in the entire hospital where I was working, and it was 4 priests and 4 rabbis. And so that experience, along with many others, has kind of brought me to one of my strong areas of research interest. So I've been working in hospice and palliative care. I'm at MGH now. I was at NYU Medical Center doing palliative care, and I also worked in home hospice, which, as you know, chaplaincy is sort of set up in a different way in home hospice. It's integrated in a certain way that we don't always have in the hospital, but there are also opportunities in the hospital you don't always get doing hospice care. So over the years of being part of many different chaplaincy teams, I've experienced wonder and awe and puzzlement and curiosity around especially the way chaplains function as members of teams. And so for me, this research, this project has really been the culmination of 20 years of wondering what's going on basically with this, and why are chaplains integrated in some places, why are there few chaplains other places, and how can we even start to begin to understand it. So basically, if you see this picture in the middle, this is our palliative care team at Mass General, and this was about the 2nd week of COVID. So it was social work on the left, me, 2 physicians, an MD fellow at the time, and an NP fellow. And to me, I really hold this up as an amazing model of what a palliative care team should always look like. However, before the pandemic at MGH, we were not really rounding as a team. My position was a newly created position embedded in a well-established palliative care team that in most ways is doing really cutting-edge work in palliative care. And yet this was a new role. And when we started rounding together, we noticed things. Suddenly we're actually feeling a little less isolated. We're providing actually holistic care. We're supporting each other when there's a case that isn't going well. Sometimes it's actually probably more efficient because, as we know, when we look at total pain of our palliative care patients, sometimes the real area of pain is not just the physical, but might really be the spiritual, existential distress, emotional distress. So really my role is at the forefront where the other providers might pull back, and that changes from patient to patient. So my question that I'm exploring is, if spiritual care is a fundamental aspect of palliative care, which it is, then why is chaplaincy integration so inconsistent across the United States? So if you look at all these handy bullet points with facts about spiritual care, things that we know, we look at the NCP guidelines, domain 5, right? Spiritual and existential aspects of care. Those are the key domains of palliative care as defined by the National Consensus Project. We also know that spirituality is an important resource for coping, and we know that a significant percentage of patients experience spiritual distress. We know a substantial majority of hospitalized patients want spiritual care. We know it's correlated with increased patient satisfaction. We know that chaplains can really be this nuanced communication between patients and team members when patients and families are making medical decisions. And we also know the last chunk on the right starts with religiously observant patients was from Tracy Balboni's work that showed that when patients and families who are religious received embedded spiritual care from a team in the hospital, they were less likely to seek aggressive, inappropriate, intensive end-of-life interventions. And they were also more likely to elect hospice. So we know that these things matter, right? And so why, in some places, big medical centers, they're one chaplain, and then other places it's 2 chaplains, 2 social workers, 6 NPs and 1 physician, and then you go to another place down the road, and the makeup of this team is completely different. So I know that a lot of what we do is advocacy for spiritual care. We show up at the table. We take part in goals of care conversations. We do joint visits. We try to broaden and expand what we do as chaplains to not only to talk about it, but to really be it and embody it. And that's another thing about team visits is my colleagues got to see what a chaplain actually does with a family, and not just with a religious family. It's not just hold hands and pray, as Denise Hess's delightful video shows, but instead to really have that nuanced, individualized care. So what's the deal with that? That is my question for my research. And so we can go to the next slide. So there's, go back. Let's see. Okay, and so we know that it's inconsistent with guidelines. We have some limited data around the integration of chaplaincy. There was the National Palliative Care Registry. This was around 2013, 2014, 2015, we had information. But for example, in 2015, 44% of palliative care teams met requirements for staffing. And specifically, the chaplain was the missing team member in 70% of these programs. So, and the other piece that I want to look at in my study is chaplaincy subspecialty training, the PCHAC certification, palliative care, and hospice advanced certification. This is a program that the BCCI, in conjunction with NACC, rolled out. It's actually a joint subspecialty certification. It's been available for at least 10 years. And yet this subspecialty certification has really been kind of slow on the uptake. So there's maybe 60 or 75 people who are PCHAC certified. Frankly, I actually only did mine a year ago, truthfully. And so what's going on with that? I wonder why has it been so, have people been applying? Have they not been applying? Do they see its value? Do our departments see the value? Does the team see the value? Do people even know that there is such a thing? Do chaplains know? And more importantly, do our interprofessional colleagues know and understand? So we'll go to the next slide, and this is kind of a crazy looking slide, but this is the fun stuff for me. So basically, it's a 2x2, and this is what I'm going to do qualitative research on. I'm doing a mixed methods approach, which means I'm doing quantitative survey, and I'm also going to do qualitative interviews with teams. Okay, so bear with me here, but this is a little bit fun. So the top is the level of structural and procedural integration of chaplaincy within palliative care. Okay, so it's either the chaplain is not involved or really involved. And then it's also looking at the specialization. So the chaplain is either kind of has that basic training, maybe is a clergy person, but doesn't have CPE, all the way down to a highly specialized, board certified, subspecialty trained chaplain. And so as you can see where those arrows go down, this is what we're looking for. We're looking for high integration, meaning the chaplain's part of the team. They go to rounds, they go to goals of care conversations, they show up. There's not a lot of gatekeeping, right? Because we've all seen that sometimes. And the chaplain really has that high level of education. So they really, we know how to refer, we know how to kind of take it to the next level. We know how to do quality improvement. We know how to be research literate. We know how to show the evidence base for what we're doing. So basically, I'm looking at the teams where I'm just going to look at these different groups of teams where, for example, they have this incredibly well-trained chaplain who really isn't part of the team. We've seen that, right? You can probably think of a friend, you know, who's this rock star chaplain who's doing great, but is trying to figure out even how to attend a family meeting, right? And then we have other people who might actually have these wonderful opportunities, but haven't gone to pursue that advanced certification. What's the reason for that? So my goal is to kind of do, let's call it a mapping study, to just like an exploratory study to understand what's going on. And my final slide, if you could go to that one. So as I said, mixed methods, so an online survey of inpatient palliative care teams, also working with PCQC, is that what it is? PCQC? PCQC? The one that has all the quality information about all the different teams. So there is some information about team setup, but for example, is the chaplain hired under the Division of Palliative Care, or is the chaplain in the spiritual care department? That's interesting, right? Because it affects the way that you're part of the team. You know, how many social workers do you have? How many chaplains do you have? And like in a place, is it a place where there's 15 social workers and 1 or 2 chaplains, or is it 4 and 4? How is that understood? So here are some of the things that I think I might discover, and I'm not sure. And you can go ahead and go through them, Andrew. They're sort of individually laid out. So is it financial factors? We just can't afford it, or we don't want to pay for it. Is it? Keep going. Do we have not enough trained PC chaplains, right? Is it a workforce issue? Is the real issue is just we don't have enough people to do the job? Is it perceptions about the role and the functioning of chaplains? Is it because people think we just, oh, they're not religious, so they don't need the chaplain? Or no, they don't need someone to pray with them because they don't, whatever. Is it perceptions of the impact of the spiritual life in seriously ill patients and their families? People just think it's kind of separate, or it's something we don't talk about. It's like it's politics and religion. We don't talk about those things at work, right? Is it people's feelings about that? Again, is it difference? Is it a lack of understanding about the roles of social work versus chaplaincy? I spend a lot of my time, I think, kind of articulating. I have this handy Venn diagram where in the middle it shows what we both do and what social workers do and what chaplains do really is 2 different skill sets. And then finally, I think I have one more thing. Maybe. Yes. And then gaps in training of non-chaplains regarding spiritual care. How do other non-chaplains think about spiritual care? So I'm going to figure all that out and then fix it. So there we go. And with that, Edward, take it away.
Thank you so much, Sarah. All right.
I'm not going to fix it, but really the thing is, once we know what we're working with, that's when we can set up interventions and education programs. But we can't really fix it until we know what the real issues are. So thanks.
Thank you. So true that so much of spiritual care research and implementation has been about articulating what we have and what we're working with. So thank you so much, Sarah. I feel like that was like a master class in palliative care spirituality right there. Edward, on to you.
Thank you, Allison. Thank you, Sarah. Thank you both for setting the bar high. Thank you. And I'd like to join you with what you both have mentioned, and one thing is how beneficial, what it yields to be supported by this organization that we have identified as Cambia, to be supported in such a way to allot protected time to do this type of work, and this type of work in various ways, right? And as we're describing, work in research, work in quality improvement, work in as we lean into leadership and so much, right? Because as Allison was highlighting, is all of this before was on our own time, right? And I want to point that out because I do want to celebrate so many colleagues that this is a reality, that our funding, our contribution to the healthcare field is 100% financially clinical, right? And that there is no protected allotted time. There is no funding for our time to do these type of efforts, right? And that those efforts usually is a lot of voluntary time on our time, right? And so I want to say, I highlight that piece because it's such a big impact of protecting and allotting time in a collaboration with my institution and Cambia to say this time is released so I can do this work more fully, more thoughtfully, more with energy, right? And that I'm not trying to find 2 hours or 3 hours in the evening after all of my full day work. And so it's a big thing that I'd like to say it's a celebration, but I also want to take this to acknowledge that there's so many that do this, right? And it's really a privilege to say that I'm in the community that's been invested with to do this, right? And the other thing that I want to, as Sarah was describing her project, that in those ways that we have been able to contribute is in work that we're already doing, right? And work that has been brewing in our past, work that we've been unfolding. And for me, this language here for many different chaplains, this is nothing new. To talk about spiritual pain, to talk about religious spiritual struggles, to talk about spiritual distress. And I say these using terms because I know that there's rationale why these terms are used, right? But in my project, I'm joining an effort that has already been unfolding by many, right? And I will name a few, but I can't name all of them, but it's work that Marvin Delgado Y is doing, right, about spiritual pain. It's work that Ken Pargament has been doing for 4 decades, right? It's work that Christina Pochalski has been unfolding, right? And so I say that to say that I'm joining that effort, that enjoying that conversation, and that one, I am a palliative care practitioner, right? So as a palliative care practitioner, I'm thinking of bringing that work in this particular setting we call palliative care, right? And so I don't want to read all of these verbatim here, but at the heart of the problem statement is that spiritual pain, religious spiritual struggle, distress is painful, right? And there is enough backup evidence that has demonstrated of how it impacts humanity. This is not, oh, it may be. This has been studied, this has been shown that it has a lot of painful experiences for many different human beings, particularly when I'm speaking of is those are followed and accompanied by palliative care, right? And so this is an issue, right? So if we say that this is happening to many of our patient population, right? So how we identifying it, how we responding to it, etc. And this is the interesting thing this is where I'm joining that effort, right? Joining that work is that with all the testing, and there's screeners that have been developed to identify this with our patient population, that a few of them are beginning to test it in palliative care patient populations, right? The one And this is one as a decision that I had to make as a project leader, was which one will I begin testing, right? And the one that I decided to test was the one that is named the Rush Protocol. And it is that tool that George Fischette and Fisk developed and has been tested in various settings. And one of the things that it appealed to me was, one, it's been tested in pediatrics, it's been tested in oncology and various settings. But the only thing is that it has not been tested in the palliative care setting. And so out of my curiosity, is like, I wonder how this would work, right? And so the goal for this project is to test that, the Rush Protocol. And one of the things that we're curious about is, one, and again, one of the things that I want to point out before I go into that is that this tool is not for a chaplain to be using. It is for palliative care non-chaplain clinicians to use. So the nurse, social worker, physician, APN, etc., to use. And my curiosity is, how would they receive it? Was it workable? Is it doable? Is it do they envision it as, is it clinically feasible for them to use, right? And so that's what we're hoping for, to find out more, because we don't know, right? And so here, again, I'm not reading these verbatim, but these slides are made available so that you can see the general big picture of what we're focusing our project is. We want to test it here. So in my project is to test this in the inpatient population, and that's during admissions, maybe a new diagnosis, all these things we don't know. So we want to see what we find out at the end. And then there was a period that we'll take a pause and we'll transition the use of this protocol to the outpatient setting. And again, use it in the same way. And when do we use it? How frequently should we be using this to identify? Should we be using it every 3 months? Every new big picture progression of disease, for example? We don't know, right? And so that's part of our hope about what we're wondering about the results, right? The other lovely piece here that I'd like to highlight, I'm bilingual English Spanish speaking. So I know that there's many in the palliative care population that are not primarily English speaking. And I'm not just referring to Spanish speaking, but part of our project here is going to be using it in other languages. In what fashion? Through interpretation services. And we want to see if it works, if it actually identifies, screens for religious spiritual struggles, right? And so as I think about this project in an 18-month time frame, right? That time frame will go. It seems like a lot, but it will go by really fast, right? And I've listed here some major phases, right, of what we're doing here. So one, there's an initial phase where we're reviewing, we're preparing, we're submitting for IRB, we're reviewing the protocol, we're trying to get feedback from our clinicians to see, hey, maybe you should think about saying this word instead of this one, and all of that feedback, right? Which is what we're doing here to see how can we use this tool, or how can we modify it or make some suggestions to it for future use, right? And then the second and third phase are the actual testing of it, right? And then the fourth is what we gather all that information, look at it, and I love this word, dissemination, which I will share in the next slide, but not just yet. But it's this effort. It's not just for Northwestern, but the effort here is to share it with the world, right? To share it with colleagues, to share it with others, whoever, so to see if it's useful. Because at the end, part of our hope is we're trying to, again, address a very real need with humanity within the palliative care setting, and that is to identify, to screen for religious spiritual struggles, right? Next slide, please.
Thank you so much, Edward. I just want to make sure we have time to move over to Corey. So would love to hear maybe just a thumbnail sketch of this slide here before we move on.
I'm sorry, do you just want me to summarize it in a brief way, or do you want me to transition to Corey?
That would be awesome. A broad summary would be great. And then hopefully we can come back to more of the details in the Q&A.
Yeah, of course. So with this overview, the other contribution within Cambia is to think about how we are leaning into leadership, right? And the ones that I want to emphasize that give fruit to the center column is really relationship, professional at every single level, whether that's networking with different organizations, different communities. And I've been doing a tour of many different conferences and et cetera, and all these little images down there are people, and I know it's hard to see, but it's a very interesting development here of relationships, of great people doing great things in various settings. And with all of these relationships, they bring fruit to many active projects, right? Beyond the other project that we have unfolding. So educational projects, writing projects, etc. And I'll stop there. Thank you.
Great. And so thank you so much, Edward. So concrete and just really so excited to see what you find so that we can all implement from what you've learned. So next we have Corey Kennard. I will let Corey speak for himself, but I just want to when initially there was not a spiritual care provider on the advisory board for the Sojourns Scholar Program, and that advisory board serves as the primary mentors to the scholars, but also participates in the selection. And it was so just affirming and validating when I found out that there was going to be a spiritual care provider on the board, and then also to find out that it was Corey, who comes with such a helpful glimpse into what it actually means to run spiritual care and palliative care in a health institution. So Corey, I'll hand it over to you.
First of all, I want to say thank you, everybody, for just your powerful words. And Allison, you're the trailblazer as it relates to the Cambia Scholars. And I want to thank you for being who you are. And I'm so happy that I was able to contribute to Sarah and Edward receiving their award as well. I think it's important to note that you three are the three as it relates to the years and years of selections that have gone forth. And that means that we are blazing a trail for others to follow in many different facets of spiritual life and spiritual health care. And so I want to say this because the most important thing, I think, is to listen to those who have questions and thoughts as well. But I want to share a story that I believe really summarizes why we're here, even talking about what we're talking about, and then where we need to go and what we need to do that. And I'm going to do that very, very briefly. There's a story of a young man who was seeking enlightenment, and he went out to the forest, and in that forest he sat down under a tree and he began to meditate. And as he meditated, he was in a position where he saw out of his side view, there was actually a crippled fox. The crippled fox had no front legs, and it was just kind of lying there on the ground. And he didn't really do much with that, didn't pay attention to it. He became hungry, went into the town and ate, and he would come back. And then as each day would pass, he would do the same thing. He would look at the crippled fox, and then he would go into town and eat and come back. And then one day he heard a roaring lion, and this particular lion was, as he heard, headed his way. So as he was heading his way, this young man climbed up the tree out of fear. And what he saw was this lion had a piece of meat in his mouth, and he kneeled down and he gave that meat to the crippled fox. And so at that moment, the young man had a spiritual epiphany. And he said, wow, that is great. He said, I want to just meditate and not have to worry about going into town and eating. And so maybe spiritually I can be fed while I'm here meditating. And so the young man remembered that story of the lion and the crippled fox, and he sat under the tree and he began to meditate and didn't go into town to eat anymore, waiting for maybe someone to bring him food like the lion did. And so he sat there day after day and became weaker and weaker to the point where he was near death. And the spiritual teacher came walking along in the forest, and he saw him, and he went over to him and he said, what's going on? Why are you lying here like this, wasting your life away? And he said, well, I had a spiritual epiphany. And he said, I saw the crippled fox being fed by a big lion. And so the spiritual teacher said, yes, that was a spiritual experience. And he said, really? I'm dying. What's going on? How can it be a spiritual experience? And I feel like nothing is happening for me. He said, well, my friend, I have to ask you this question. He said, why did you choose to imitate the crippled fox as opposed to imitating the roaring lion? And so this young man was in a position where he was going to lose his life, seeing something spiritually happen before him, but handling it and attributing it in the wrong way. And so I believe that today, far too long in chaplaincy, we've been that crippled fox. We've been that fox that's been waiting for that opportunity to chew on the aspect of being a part of a healthcare team, and we've been sitting there waiting. Well, the wait is over, as you see by the three that are here. We no longer can wait any longer. We have to take on the attributes of the roaring lion. And if we take on those attributes of the roaring lion, we will see ourselves as feeders, those who are able to bring substance to those who are in need, to help those who are in need. And we need to see ourselves in that role. So my role on the Cambia board is really to put ourselves in a position as spiritual care leaders in the community and in healthcare, in a position where what we do is well respected and honored. And a lot of times the roadblocks come, as the three presenters that you heard already said, the roadblocks really can come from our fellow clinicians, those who are providers in healthcare, those who are on the palliative care teams, those who are working in healthcare. A lot of times they don't see their own lives as being spiritually vibrant and connected. And so therefore, they don't oftentimes see the things that we do as being just connected to the work of a healthcare provider in a hospital. And so my drive is this, as I prepare to close and turn it back over to Allison, my drive in all of this and being a part of the board is that I believe that chaplaincy is a true treasure that's been buried underneath everything else that's going on in healthcare. And so we need to look at three things that we need to do in order to bring it more to the surface, like you pioneers are doing right now. And that is, number one, we must believe that the treasure is there. We must believe that chaplaincy is important. We, not others, but we must truly believe that we have a place on every particular palliative care team in the hospital, whether it's invested in or not, whether we are actually a part of it or not. It starts with us believing that we belong there and that we are just as important as any other member of the healthcare team. Secondly, if you're going to go after a treasure, you must not only believe that it's there, but you must also believe that you will find it, that you will find that treasure. I am in a position where I believe that I'm seeking out and finding the treasures of those who are serving in chaplaincy all over the country. I want to continue that search and that drive to bring to the surface the brilliant and great ideas that these chaplains have that can transform healthcare. And number three, you got to believe that it's worth it. Every moment that you spend seeking to bring that treasure to the surface, every moment that you spend trying to become a part of a team in the hospital, you must believe that every hour and every second that you spend is worth it, because it's going to break down the barriers that are before us even today. And so I'm believing that the treasure is there. I'm believing that we will find it. And I believe truly in my heart that it will make a difference by virtue of that third point. And the third point really is it's worth it. And so I want you to know that all of you are worth it. Everyone that's listening right now, you're worth it. If you're in spiritual care, we want to continue to push you to apply, to do the research, to do those things that are necessary to become a part and raise your voice. I'm telling you, I didn't become a part of a palliative care team until I began to show up at meetings that I wasn't invited to show up to. And so people didn't have the courage to disinvite me. So I just became a part of things. So I'm telling you right now, be that roaring lion and go out there and just raise your voice and raise your spirit and raise the standards of healthcare by virtue of your presence. And I believe that that's going to make all the difference in the world. So I'm excited, about everything that's happening and these projects that you will see transform really healthcare as a whole, not just the three here, but many of those who are trying to do the same thing. The three of you are just truly blessed to be in the position to lead the way in all of this. So I thank you for allowing me to be a part of this panel. And I'm open now, Allison, to whatever else you want me to do and want us to do.
Excellent, thank you. Well, I always think of you, Corey, when I invite myself to meetings now. So thank you for that inspiration. I have a question for everyone, and then I think we have at least one question coming up. But for those who are attending the webinar, please feel free to add your questions, and I hope that we will get to them. So my question has to do with mentorship. Mentorship, I don't know if we've really emphasized this today, but is a huge part of this award. I think really the selection committee, my understanding, is looking for just to see how any awardee from any discipline is going to be working with those who have been in palliative care and maybe know something about what it is we're trying to do. And I know for me, I don't know for sure, but I think the minute that cinched it when I was interviewing was when I actually had the business card of my primary mentor, Dr. Gary Buchholz, who's a physician here at UCSD and used to be the leader of our HPM fellowship, right? So he was my local mentor, and I happened to have his business card in my suit pocket because, I had met with him during my interview back at UCSD. But just to say, like, I have this person with me, you know what I mean? And I just wanted to check in with you all to see, how do you think, the mentors that you chose formally and also maybe informally so far, you're seeing these networks, how do you think they got you to where you are now, and how do you hope that they're gonna get you through these next couple of years?
I guess I can go first. Edward just gave me the look. Thank you. And actually, it's funny because I wanted to make a shout out before we go to, so my Cambia application mentors were the wonderful Georges, the Uncle Georges, George Fichette and George Hanzo. And so George Hanzo really kind of, lit a fire under me in terms of leadership and, kind of thinking big and thinking about systems. And George Fichette, I just had the immense, as I always say, he's one of those people that's so busy and yet always has time to talk to you on the phone, like the next day, and explain things that really I should know by now about research, but just do it in this way that is incredibly generous. So he helped me talk through a lot of those things, and so did George Hanzo. But, I will say, and I don't want to come across the wrong way, but there isn't a lot of mentorship for me and a lot of the institutions I've been in, because there are not a lot of people who are kind of trying to bridge this world of research and palliative care chaplaincy. But now, there weren't. Now there's more of us, right? And so I think we're mentoring each other. Like, we're really kind of have this critical mass of research, and Paul and Dirk and, all the folks who are doing transforming chaplaincy. I think we have sort of a lot of peer mentorship. I don't know if we have a lot of folks who are kind of teaching me how to do everything, but it's sort of pulling together a piecemeal approach. I will say, thankfully, I've also have amazing research people around me at MGH. And the thing is, I need to learn from them because these are like the real research people. And so I've had this kind of crash course and some official clinical training now on how to submit an IRB. How do you write up all these things? How do you write a protocol? How do you write interviews? That piece is really hard. And that's a place where I think we really need to continue to grow with mentorship. That's been a sort of a stumbling process for me, but I'm getting there. So I don't know. What do you think, Edward?
Thank you, Sarah. It's so interesting how we know our nonverbals of when we're seating for the other to talk. But that's how these relationships have evolved, right? I love the question. I think one of the things it comes to mind when I think of my mentoring team is so subjective, right? Subjective to each of us. And for my case, George Fichette, as generous as he has been with so many, he's been on my journey for about 5 years, longer. He was actually my supervisor within my doctor ministry project. And so he and I work very closely together. And so he's one that has invested hundreds of hours into leaning into my life, right? Professionally, as a leader, as a researcher. And that is, and I say subjective because I do have a mentoring team of 3. And so how the arrangement we came up here for this mentoring moment is that he will focus on the project with me and offer some guidance with that. The other person I want to highlight is Christina Puchalski, and she's an MD. And so I so much appreciated her. And, for those that don't know, but Sarah and Allison and Corey know this of me, is that I invest a lot of my energy and skills in education, right? This is a person who has been in the world of palliative care for a long time internationally and has invested a lot in the educational realm. And so who better, because part of my project has an educational component to it as well, including other efforts that I'm unfolding. But Christina is leaning into my narrative in those ways of how to offer and how to think about spiritual care education in a global setting, right? And who better, right, than Christina? And then the third one, but certainly not the least, this human being is an amazing, lovely colleague. He trained me how to be a palliative care practitioner, not as a chaplain, but as a generalist, as a physician, as a generalist in nursing. In so many ways, he leaned into my narrative from the very first day of palliative care work, and that's Josh Hauser, right? He's an MD. He's been in this field for over close to 40 years, and so there's so much wisdom, so much experience, but also so much humility, right, of how he meets me where I'm at and how he leads into me. And he's helped me so much in the terms of how to be familiar in palliative care, but also in what are my other areas of growth, right? And so I'll stop there.
Yeah, and thank you, everyone. So maybe we'll have time for just one question. I just want to point out that just this web and network of mentorship and collaboration, I'm just hoping everyone who's an attendee in this webinar too is thinking about who are your mentors and who are folks who can help you kind of launch in this direction to, continue to support your work. Do we have time for one question? Is there a question?
If all of you can stay on for a minute, but it's top of the hour. So
Okay.
Tell you what, for the person who sent the question, track us down. I have your information. I know there's some questions that are in there. And folks, I see some hands that were raised. I wish we had the ability to engage that. We don't. So I'll get the question off to the person. I saw your name in there, and we'll find you and get that. I want to say thanks to you, Allison, for moderating. Thank you, Sarah. Thank you, Edward. Thank you, Corey, Pastor Kennard. Great to meet you and great to have you here with us. I thought with that crippled animal story, you were going to talk about tigers, but that wasn't, okay. All right. My twins are playing your tigers in about an hour and a half, so I know. I'm just playing. But seriously, friends, I've been waiting for this for months, and you didn't disappoint. Thanks for hitting the home run. Thanks for being here. And friends who joined us from far, thanks for your work in this field and the difference that you make on your teams and the people that you support in the midst of serious illness. Thanks, everyone. Take care.